know everyone on here, but just in case everyone else doesn't know each other, maybe we can do introductions really quickly.
Yeah, that sounds good.
I don't know.
I guess I'll just start real quick. I'm Jody Dickmeyer. I'm a general pediatrician and lead of the healthcare sector and also helping lead the Just Walk subgroup. I've been at Children's for about 11 years now.
And I'm Shelley Summer. I'm going to give one quick update. I think you all know I'm from Children's Mercy, but I manage the program that is now called the Kansas City Healthy Lifestyles Collaborative, formerly known as Weighing In. We went through a renaming and process over the last, I'm going to say, year and a half. That's the name that we landed on, and we've just updated our logo and color scheme, and so you'll start to see this new name and branding in 2023. So it's still, we still are managing the same great work, which includes this physical activity plan. But we thought we knew we wanted our name to reflect what we're doing better than it did. So Kansas City Healthy Lifestyles Collaborative. And on our team is Katie Amy, who is also here. She's providing some of the background support for all of this, helping get the meeting invites out, Zoom links, all of that. So we're happy to have her as part of our team. So Jay, you want to go next?
Yeah, I'm Jay Robertson. I'm not muted. I'm Jay Robertson. I'm a sports medicine physician at Children's Mercy and part of the KCBA plan in the sports sector and the healthcare sector, and working on the curriculum group. So I'll be giving an update on that today.
Ed, you can go next if you don't mind.
Sure. And Jay, I believe I saw you on the last planning session as well for the UMKC's community health fair. Ed Kramer, I'm a family doctor. I've been affiliated for the last 11 years or so with University Health. And primarily these days, my only clinical work is with the Sojourner student-run free clinic. But I'm very interested in teaching. So I work with year 1 and 2 medical students with UMKC, some of the upper level students as well. And then I'm the medical director of the PA program for UMKC. Long-standing interest in community health, and with the most recent Jackson County Health Department initiative of building a healthier Jackson County, I was co-lead for the Healthy Eating, Active Living arm of that. So that fits right in with the Healthy Lifestyles rebranding. So, and really just have known about Weighing In for years, but just recently was able to attend a meeting at the Kauffman Foundation. I guess it was several months ago now, but glad to be able to join your group. So thanks so much.
Great to have you. Sadie, do you want to go next? Great to see you today.
A couple months. So I'm Sadie Engelken. I'm a clinical exercise physiologist in the Kansas City area, teaching as an adjunct when needed at Cleveland University, Kansas City, in their exercise science undergrad major, and then primarily serving as a wellness coordinator in many HCA hospitals across the Kansas City area and the Sarah Cannon Cancer Centers. So that's me.
Great. Caitlin, we'll have you go, and then Stephanie.
Hey guys, my name's Caitlin. I work in the Heart Center at Children's Mercy. On the EP team, so I work specifically with Project Adam, which is a program that helps get the community and schools to be heart safe and prepared for cardiac arrest. So I'm just kind of dabbling in with a bunch of the different sectors and trying to just see where I can help out.
Hi, Stephanie Ellison. I'm an emergency physician at University Health and the Associate Dean Season Learning Curriculum. Hi. You're in.
Thanks, Stephanie. Somebody will let you take it over from here.
All right, so part of our healthcare sector is branching off into the 3 different subgroups that we've been working on. So our curriculum subgroup, our billing subgroup, and our Just Walk subgroup. And since Jay just finished his meeting right before us, I figured it's fresh in his mind. So I was gonna let him go first to talk about the curriculum subgroup.
I've already forgotten everything we talked about. No, we had a pretty good meeting, had some new faces on yesterday over the course of the last month or two. Shelley and I have talked with various groups of folks, some at KU, some at Kansas City University, a few at UMKC about trying to kind of add to the medical school curriculums and the other allied health professional curriculums at each institution into something resembling a lifestyle medicine program, potentially doing something huge and awesome and wonderful, like changing the curriculum completely, but probably not. But we're going to start with just showing people kind of how it can be done. That's kind of our goal 1. And the idea is to bring Dr. Jennifer Trilk from University of South Carolina Medical School into town and maybe talk like grand rounds for all 3 healthcare institutions, educational institutions around the city at one time, or maybe 3 separate grand rounds, but all within the same, couple days she's in town, and then also have some smaller group time with actual faculty development leaders who can kind of have some say on the curriculum and change things. So kind of like a big, hey, this is how we do it at University of South Carolina. We got this wonderful program where it's really integrated into the every phase of the medical school curriculum and the allied health curriculum. This is how if you were going to go all in, this is how you could do it. But then having her sit down with some small groups and giving some ideas of maybe how we could make small implementation changes at each med school campus. And that is the big goal. We haven't set up a date, or we haven't set up exactly if every institution is on board, although it sounds like at least the stakeholders we've gotten to talk to think it's a good idea. But there's at each institution, I think, several more people to bring on board to really get it finalized. But that's what we're working towards at the moment.
It's awesome, Jay. Thank you. Does anyone have any questions for Jay before we move on to the next one?
I did want to share a little bit of additional information for those of you who might not be familiar with Jennifer Trilk and her work to establish a lifestyle medicine curriculum at the University of South Carolina Medical School. She's recently, as part of their efforts, been included as one of the leads for the White House conference on hunger, nutrition, and health. So I'm not sure if all of you are aware of that. It's not just nutrition. So let me say that differently. It's nutrition, hunger, and health. The health piece includes a physical activity component. So one of the 5 strategies is around physical activity. And they are at the University of South Carolina School of Medicine. They are helping to implement an open source lifestyle medicine curriculum in all interested medical schools. They're also going to be providing guidance to the National Board of Medical Examiners, which is the primary organization assessing the competency of medical providers. So they're going to be consulting with them in terms of questions and content related to medical school. So we often know that curriculum doesn't change unless there's it's on the test. And so they're doing both of those things. They've got the curriculum developed, and they're also going to be influencing and advising, we hope, on what's included in medical exams going forward. The school will provide 637 health systems and 755 YMCA associations with consulting and free access to its Exercise is Medicine Greenville Toolkit, which is the 12-week program using exercise to mitigate risk in chronic diet-related diseases. So they've got a lot going on. This is one of the reasons we want to bring her to the Kansas City area, because it aligns so completely with the strategies of the healthcare sector. The curriculum group focuses specifically on strategy number 22, but her other efforts align with 19, 20, and 21 as well. So if you have any questions, I'll be quiet and let you ask them. But if you're interested in participating in those meetings, please let me know. We'll add you to the distribution list for the meeting invites. That was really our first meeting today. And so we're just sort of getting this part started.
That all sounds
Sounds
great
amazing.
to me. I just want to point out, I don't know if Dr. Ellison is able to hear us right now. I know her connection was not good earlier, but she knows all about the curriculum of the School of Medicine, having shared that whole effort for a number of years. So hopefully
She
we
is
can.
she
Yes,
is part
she
of
is
that
highly
group.
involved. Yep.
Well, she's in that group. Okay, good deal. Well, I'll keep quiet then.
Yes, I am involved.
Hi,
I'm
Stephanie.
just trying to figure out what the what is, and then we obviously have other curriculum leaders, but I'm also the connection to the interprofessional schools as well. But once we kind of have an idea and a plan, I know it's a focus for the wellness and mental health of our current medical students, and so I think this slides in easily for that strategic focus for this upcoming year.
Great.
All right, if there's no other questions, I'll move on to the Just Walk subgroup of this. So Just Walk is part of Walk with a Doc, if you guys haven't heard of it. Started by a cardiologist in Ohio to try to promote healthy living for his patients. So we started a Just Walk subgroup, and Just Walk is including all healthcare professionals. So it doesn't have to be a physician who's leading the talks. We started this last April or May in Wyandotte County at Pearson Park, hoping to try to expand to that county specifically due to just one of the worst numbers wise as far as like obesity and health related issues related to weight. We are having some difficulty over the winter trying to get people involved. So we are coming up with some different options, and then also trying to decide if Pearson Park is going to be our permanent place or if we're going to try to find another place in Wyandotte County. In relation to that, we have also reached out to Chris Harris of Harris Park in the Ivanhoe district to see if it would be potential to host a Missouri Just Walk at his park location. If you guys aren't familiar with that, we can post something about that in the chat as well. So we're in the preliminary stages of exploring that option, but we do want to open a second site in Missouri. So if you have any additional thoughts on that, please let us know. As far as our meeting this morning, we did decide to halt the February and March Just Walk in Pearson Park, just based on weather and difficulty with promotion of that area, and hoping to restart it on April 1st. So April Fool's Day. Does anyone have any questions about that?
Jody, I live in Lee's Summit, and I know Lee's Summit has a very, very active Parks and Rec department. So I don't know if you've connected with them at all. I imagine if they don't already have something like this, they'd be interested in participating. I can connect you if necessary.
Yeah, great. Shelley, we do have the Johnson County, we have Parks and Rec person affiliated with us for the Johnson County, but I don't know if we have Jackson County. Do we, Shelley?
We have Jackson, Kansas City, Missouri, Parks and Rec.
Yeah, okay.
I had talked with somebody at Lee's Summit. Now it's been quite some time, but I haven't seen them attending our meetings lately. So a lot's happened between the last time they participated and now. So a reconnection, or maybe it's a connection to somebody new. That person may not be there anymore. So yeah, if you can send us the name of a contact or just send an email and copy like myself on there, that'd be great. I'd be happy to introduce them to what we're doing and invite them to participate.
That'd be great. I wonder, it would probably help me if one of you could send me an email with information about this program, and then I can forward it on and connect you that way. Would that be okay?
Sure. We'd be happy to.
That'd be great. Joe Snook is the director of Parks and Recreation, and they've got all kinds of people who would probably love to do this sort of thing.
Great, thank you. I'm guessing you guys have Ed's email address, or should he post it in the chat? Yeah, you have it.
Yeah, we have it.
Does anyone have any other questions on the Walk the Dock, Just Walk program? All right, Shelley, I'll let you move on to the billing subgroup.
Sure. Dave White is leading the billing subgroup. He's not able to join us this morning. He had a conflicting meeting, but he did share an update. He said they are moving forward with the REPS app development. And I can't remember what REPS stands for, but it's about the assessment of physical activity at home. So they're moving forward with this app development and are getting billing folks to join their team to see if they can leverage some of the remote patient monitoring billing codes for reimbursement. So as we start to put all these pieces together and talk about physical activity in healthcare training, and we do some role modeling activities led by healthcare professionals with Just Walk, it is going to be important for billing and reimbursement, or we're not going to be able to sustain these activities. It's going to be primarily driven by just people and their interest. So Dave is leading this very small pilot project, looking at how we take advantage of some of the codes that already exist related to physical activity assessment, and see if we can't get some, see if there's not a mechanism for reimbursement for using those billing codes. He did indicate that what is done at Children's Mercy for billing and what other people across the country might do for billing seems to be very different, especially related to remote patient monitoring. So one of the things he suggested was maybe a pilot would be useful in another setting that might have, and I don't even know what the right terminology would be, but maybe a more streamlined billing process. He couldn't really speak to what Children's Mercy does that's so different from other organizations, healthcare systems. So if anyone is interested in advancing something like that, I think that's something we would certainly consider, and potentially help facilitate getting that started in other places. He did mention that he'd like to get the group back together again and review both what he's doing from an update standpoint, but also put together what information on what professional organizations recommend related to billing. So the American College of Sports Medicine is actively involved in this process and trying to get billing and reimbursement related to their exercises medicine program, but I think there are other assessment and counseling opportunities that might be available as well. So if you're interested in participating in that subgroup, let me know and we'll add you to that list. So as he sets up the next meeting, you all can hear a little bit more about what he's doing in detail, and we can identify if there's another person or group that might be able to pilot something.
Shelley, again, I think I have somebody who might be interested. This is David Varan, Dr. Varan at UH Lakewood. He actually one time worked for Cerner many years ago. He's a family doctor, but he's currently involved in some research on wearable devices and remote patient monitoring and things like that. and knows a lot about the computer side and probably the billing side too. So I can put his email address in the chat, and if you want to send me something to forward to him, I'm happy to do that as well.
Fantastic. Thank you.
You bet.
Well, it's a good thing you hopped on today. You have so many connections for us. Thank you.
Well, I've been hanging out in Kansas City for a while, so I know a few folks.
Know a thing or two. But yeah,
I can
Shelley,
attest to that.
I do think it would be nice if we had someone who does their own billing to see if this is something they're already doing or something that could be easily added. But like Helena said in the chat too, it's hard when we don't do our own billing, the coders do the billing, and it's just a harder mechanism to break into, I think.
I agree. Sadie, do you have any idea how this might be done at HCA?
So currently, in terms of like me providing consultation or exercises, it's called like a service of good merit or something like that. So basically the hospital upfronts our costs, and the goal is downstream savings or revenue. So whether that's referral to billable sources like physical therapy, or home health, things like that. And then in terms of like cost savings, like decreasing 30-day readmission, decreasing length of stay, things like that. We're hoping to potentially in this next year in terms of, ACSM doing, if they're, I'm on a clinic, or even looking, if you are a CEP or an EP, or are there ways that we can maybe bill as under a provider consultation? But, if a provider had a meeting with someone and then I came in, could it be an additional, consulting fee? But soon to come, hopefully in this year, I at least know to get their own provider NPI number. That was something we discussed last week, that, that wasn't even something possible for us now, but that we can get our own provider number in terms of making billing easier down the line. Any questions?
Thanks for that, Sadie.
And any updates that you get as you participate in the work with ACSM would be helpful. Dave may also be participating in some of the billing groups. I'm not sure. But I think it's really important to track on what they're doing, since that's a big, it's very relevant to practitioners in that college, in the American College of Sports Medicine.
I'll definitely keep you updated.
Thanks.
So I did forget to mention, and Caitlin, I don't know if you want to step in here and say a few things too. We did want to have Caitlin present one of our healthcare topics at our Just Walk subgroup. And if you want to just kind of chat about what you've been working on, that'd be great.
Yeah. So Project Adam become heart safe by preparing for cardiac arrest. So we work really closely with school nurses to develop like cardiac plans. So you have a written plan and you have a specific team that would respond to emergencies, and you then you practice drills with your team so that if there were to be a cardiac emergency in a school, they're prepared to save lives. So that is what Project Adam is. And at the Just Walk on April 1st, we can do, I can talk about Project Adam and discuss that. And then I also wanted to do some hands-only CPR training with everybody that was there. And that's kind of what Project Adam is. It's a free program. And we really just want people to be prepared. That's really the only way you can save lives, is to be prepared for this to happen. You don't want it to ever happen, but when it does, people that are more practiced and rehearsed feel more comfortable and confident to do CPR and to have a plan in place when they know who is going to respond and what their roles are. So that's Project Adam.
And remind me, are you guys helping fund AEDs, or do most schools have those?
Most schools have AEDs. I haven't encountered a single school yet that I've worked with that doesn't have AEDs. There are some schools that want to get more, but the recommendation is 1 AED per 500 people. So if there's not more than 500 people, it's not really a recommendation per se to have more than one. But there are schools have AEDs. There's only like one person who knows where they're at, and they don't know that when you open the door, it'll alarm. And so just if schools need help with funding, we do have resources. We don't have any funds here at Children's Mercy yet. Hopefully that'll come soon to help provide AEDs, but that's not something that we do quite yet. We have resources that we can get people in contact with that can help provide them, but not specifically from us.
Great, thank you.
Mhm.
Does anyone have any questions for Caitlin? Do you find most private schools also have them, or is it mostly public schools?
Are you asking, do private schools have AEDs, or is it just public schools have AEDs, or vice versa? I think that for the schools that I have encountered, they have all had AEDs, but Project Adam is, it's fairly new to Children's Mercy. I just stepped into this role in August. And so the work that we're doing is really schools that are coming to us, and we aren't like doing like big workshops with schools yet, but that's definitely on the to-do list. The goal is to get all schools in the metro and even outside the metro heart safe, but the schools that I'm working with are really so far like the nurses and admins that are have heard about it from wherever, and they kind of reach out to us, and those schools typically have AEDs.
Yeah, I know you're going to help with some of our coaching around the city. The coaches want to learn how to do some of this stuff now after DeMar Hamlin. So I know Nicole Fillingham and Kevin Latz have gotten in touch with you guys. And
Yeah,
that's
we're
awesome.
trying to.
Thank you a lot
Yeah,
for doing
we're
it.
trying to do something, and I mean, you know, people hopefully have all signed up for CPR after the event with DeMar Hamlin, but that's the first step, and you know, it's not as scary as it seems. But for us, you know, if we have to do CPR today, that's fine. But for teachers and parent coaches, like it's not on their radar. So just to get them to be more comfortable and confident that if this happens, hopefully we can have better outcomes for our patients. So.
Do you guys charge a fee for doing the teaching to the schools?
No, so we don't do, they wouldn't be certified in CPR, but we can do hands-only teaching, hands-only CPR. And that's no charge. We have mannequins and we can do that. I can do that. So I hope you guys all know CPR.
Requirement for us, but very, very
I
important.
know. I work with one of the social workers on my team, though. She said that they're not required to have it. And I thought everybody in the hospital was, but I guess that's not true.
Yeah, right. I guess I don't know the non-clinical facing people at Children's if they're required or not. But we had just gone to the, every 3 months, just doing the mannequin with the modules. And that's been really helpful just to keep up skills and keep them current.
Allied health is
I
not
agree.
necessarily required. but it is an option. So if you want to attend CPR training, you can.
Mhm.
That's how I've done it.
Well, very important project and definitely, gosh, timing wise, I think people are reassessing things and making sure that they've got what they need in an emergency situation. So I'm glad that you're doing this.
Mhm. Yeah, thanks.
Does anyone else want to report out on things that they've been doing or ideas that they have?
I'll be at a meeting Friday, actually at the Kiewit Center, or I'm sorry, the Kaufman Conference Center again, with Jackson County Health Department. So I mentioned the previous initiative of building a healthier Jackson County. We're now embarking on one called Inco Lab is all it's called so far. Doesn't tell me anything, but I'm hoping we're gonna get a little more, a name that gives a little more information to somebody who first hears it. So anyway, that's in the very brainstorming stages, I guess I would say, organized by the Jackson County Health Department. So I'll try to keep you posted on what's going on there. I don't
That'll
know
be great. You're a conduit for other information outside of this.
Well, I do try to, I like to connect people these days with, people who can help each other out, have mutual interests and expertise and things like that. So it's kind of fun.
And I'll go ahead and promote our March quarterly meeting for the Kansas City Healthy Lifestyles Collaborative. It will also be held at the Kaufman Foundation and Conference Center. It's our first in-person meeting in over 2 years. We're really excited to be back to being in person. Our speaker for that quarterly meeting will be Dr. Sarah Hampel, and I'm not sure if any of you know Dr. Hampel, but she's been in the media quite a bit lately. The AAP has recently updated guidelines related to obesity, pediatric obesity treatment. She is going to be speaking about those guidelines, what they are not, and help connect that a little bit to our efforts from a prevention standpoint. So for those of you who don't know, there are going to be consensus guidelines that are going to be coming out related to the prevention of overweight and obesity. But this is specifically to obesity treatment, as many people have had questions and concerns related to those guidelines. So we're really happy to be able to have her A, as part of our team, but B, present at our March 2nd quarterly meeting. The meeting will be held from 9 to 10 a.m. Breakfast will be, a healthy breakfast will be provided. We will have meeting registration and information in the healthcare sector newsletter that will be coming out in the next week or so. So we invite you all to register and attend. And share it with others if you'd like to. Anyone is welcome. It's free.
I've got one more bit of information that Lee Summit related. I've been part of the Health Education Advisory Board and the Livable Streets Advisory Board in Lee Summit for many years. Those on the direction of the mayor and the city council, those all the boards and commissions have been dissolved and they're being reorganized. So the Health Education Advisory Board, the Livable Streets Advisory Board, and the Human Services Advisory Board, those three are being combined into what's called the Wellness Commission. I did not choose that name either, but that's what is called Wellness Commission. We're all advised if we're interested, we may reapply to see if we can be on that commission. So again, something that's sort of starting over, and I'll be interested to see how that all works out. The only thing I know for sure is I'm not going to be in charge of that.
Good for you. You know when to say no. All right, anyone else? Otherwise, we might be able to get a few minutes back. And we do have our meetings for our next one, our next healthcare sector meetings on the books. Katie, do you want to share those? Perfect. So she just put those in the chat, March 21st and May 16th. We're right now going to go to every other month, just so we have a little bit more to report at the healthcare sector meetings. So put those in your calendar, if you will, and we will see you guys in March. If you guys are interested in any of the subcommittees and want to be added to those subcommittees, so that's either the curriculum, the billing, or the Just Walk subcommittee, again, you can either put in the chat or let us know and we can add you to those invites as well. Those ones do typically meet once a month. So thanks for joining us today, guys. Have a great last day of January. Enjoy the sunshine outside.
Thanks for joining us.
Thanks.
Thanks, everybody.